So question number, we will be starting with the important questions. The question number 1, that oral mucosa shows. Option A, humoral immunity. Option B, cell mediated immunity. Option C, both. Option D, none. What is humoral immunity? Humoral immunity is an immunity where antigen antibody come into action. Here antigens are there from which are either a foreign substance or any bacteria, any virus. Against that, body makes a antibody. This is called as humoral immunity. Whereas the cell mediated immunity is a immunity which is provided by the different cells. There is no role of, or there is no formation of antibody. But oral mucosa in the body have both the types of humoral immunity as well as the cellular immunity. So option C will be the correct answer, that oral mucosa shows humoral immunity as well as the cell mediated immunity. Coming to the question number 2, the type of mineralization occurring in the dentine. Remember, dentine shows two type of mineralization, linear and globular. In globular, different globules are formed and then they fuse, आपस में fuse हो जाते हैं और एक पूरी complete dentine की sheet बना लेते हैं. That is called as globular mineralization. Then linear sheets are formed one above other. So this is linear mineralization. Again, both globular as well as the linear mineralization is seen in dentine. So option C is correct, that both globular as well as linear are seen. Failure of globular mineralization, or if these globules fails to fuse, one different type of dentine is formed, that is called as interglobular dentine, and it is seen just below the dentino-enamel junction. So remember that interglobular dentine, which is due to the failure of globular mineralization. Coming to the question number 3, hemidesmosomes help in. See, these hemidesmosome, desmosome, they are cell to cell junctions. They join two different types of cells. So basically, the main cell to cell junctions are hemidesmosomes and desmosomes. Remember, for example, this is your epithelium. These are different cells in the layer. So this cell to cell contact is made by desmosomes, whereas this cell is joined to a basement membrane by a hemidesmosomes. Now we will come to the options. Adhesion of epithelium to the tissue, adhesion between epithelium cell, option C both, option D none. So yes, this epithelium is joined to the connective tissue by a hemidesmosomes, whereas desmosomes make cell to cell contact. Option A is the correct answer. Option A is the correct answer. Coming to the question number 4. Odontoclast are derived from. First of all, this clast word you have to keep in the mind. Clast. What is clast? Clast are resorbing cells. Any cell which resorbs something is suffixed by clast. Blast is a suffix used for forming cells. Blast बनाते हैं और clast resolve करते हैं. Okay. So these odontoclasts, they are nothing but the circulating monocytes convert into clast cells. Osteoclast, odontoclast. Okay. You will see. So wherever the clast word is used, it means this is resorbing cell, and all resorbing cells are formed by the circulating monocyte. So option D is correct. Lymphocyte is an inflammatory cell, macrophage is an inflammatory cell, dendritic cells are the cells which shows dendrites. So circulating monocytes combinedly form the clast cells. The thickness of the ground section is, again, there is nothing to explain here. What is a proper ground section? A proper thickness of the ground section is when the light can pass through it. That ground section should be that much thin, simply the microscopic light should pass through this, and it should be 50 microns. So option C is the correct, 50 microns. Question number 6. The part of alveolar bone that surrounds the root of the tooth and gives attachment to the principal fibers of PDL is called. First of all, see, this is your root. This is socket, or this is the alveolar bone. These are PDL. Okay. So PDL, in one side they are inserted into cementum of the root. On another side they are inserted into the alveolar bone. What is alveolar crest? The highest point of alveolar bone is called as alveolar crest. What is alveolar process? The alveolar bone is called as sometimes as a alveolar process. Bundle bone. So this portion of the alveolar bone where these PDL, periodontal ligament fibers, are inserted is called as bundle bone. The part of alveolar bone where PDL, periodontal ligaments, are inserted are called as bundle bone. So the right answer is option C. Merkel cells are likely to be found in which of the following tissue? So for that you should know what are Merkel cells. Merkel cells are the sensory cells which are seen in epithelium. Lamina propria is a part of connective tissue. Reticular lamina propria or papillary, both lamina propria are the part of connective tissue. Periosteum is the outer covering of a bone. So the only option which is the right is epithelium. Merkel cells are seen in epithelium. So option A is the correct answer. Question number 8. Primary teeth differ from permanent teeth in following aspects. Option A, thickness of enamel and dentine. Yes, primary teeth have less thickness of enamel as well as dentine compared to the permanent tooth. So option A is correct. Pulp chamber are longer. Yes, pulp chamber of which are called as pulp horns. Pulp horns or pulp chambers are longer in the primary teeth. So option A is also, option B is also correct. Option C, roots are flaring. So roots of the primary teeth are more flared, whereas roots of the permanent teeth are compact. So roots of deciduous teeth are more flared. So roots flaring में भी primary और permanent dentition में difference होता है. So option C is also correct. So ultimately all the three options are correct. So we will tick the answer D, all of the above. Primary dentition period is, means they are asking the period when first primary tooth erupt in the oral cavity to the last primary teeth which shed off from the oral cavity. Just remember it. The first primary teeth erupts in oral cavity in 6 months, whereas the last primary teeth which falls or which shed off is in the 6 years of age. So option C is the correct answer. The highest quantity of inorganic content is likely to be present in which of the following tissue related to the teeth? Inorganic content means, what is this inorganic content? It means minerals. Ultimately they are asking which is the highest mineralized tissue, and we all know that highest mineralized or hardest tissue present in the human body is enamel. So the highest inorganic content will be seen in enamel. So correct answer is option C.